In today's world, women play distinct roles. Thus, maintaining their overall health and well-being is essential. Sermorelin peptide treatment has emerged as a promising avenue for women seeking improved vitality, energy, and overall wellness. With the help of this groundbreaking therapy, you can boost your growth hormone levels naturally, experiencing a range of benefits to uplift your quality of life. Today, we'll dive deeper into how Sermorelin peptide treatment can help a woman feel better, vibrant, and rejuvenated. Sermorelin is a synthetic peptide which stimulates the pituitary gland by producing more growth hormones. Growth hormone is a vital component in the human body responsible for cell regeneration and overall health. Modern women juggle numerous responsibilities, often leaving them feeling fatigued and drained. Sermorelin peptide treatment can boost much-needed energy by stimulating growth hormone production. This increase in energy levels can empower women to take charge of their day with vitality and enthusiasm. Dull and dry skin are some of the most prominent signs of aging. However, the Sermorelin treatment helps collagen production, leading to supple and firm skin. This boosts a woman's self-confidence and makes her feel comfortable in her skin. Healthy weight maintenance has always been challenging, but a woman can achieve weight loss goals with Sermorelin peptide treatment. The treatment helps break down body fat and encourages lean muscle mass development. A balanced approach to weight can contribute to better overall health and well-being. Fluctuating hormones can often lead to mood swings and emotional upheaval. Sermorelin treatment's ability to regulate growth hormone levels can positively impact mood stabilization. With no or reduced signs of anxiety and depression, a woman can lead her life more positively. Maintaining cognitive sharpness is essential for women juggling work, family, and personal pursuits. Sermorelin peptide treatment's potential to enhance brain function can improve memory, focus, and mental clarity. This can empower women to excel in both their professional and personal endeavors. Intimacy and sexual well-being are integral aspects of a woman's life. Sermorelin treatment's ability to restore growth hormone balance can increase libido and improve sexual satisfaction. It can lead to healthier relationships and a more fulfilling personal life. Brittle bones generally characterize osteoporosis, a common problem among women as they age. Sermorelin peptide treatment can aid in maintaining bone density by promoting the production of bone-building cells. The treatment significantly helps reduce the associated risks like fractures and bone-related problems. Cognitive sharpness is vital for women's productivity and overall well-being. Sermorelin treatment's potential to enhance brain function can improve memory, focus, and mental clarity. Growth hormone plays a role in sleep regulation. Sermorelin treatment can improve sleep quality, leading to better rest and overall wellness. A sluggish metabolism can hinder weight management efforts. Sermorelin treatment's effects on metabolism can aid in maintaining a healthy weight. Before embarking on Sermorelin peptide treatment, women must consult a qualified medical professional. A thorough evaluation of medical history, present health status, and treatment goals will determine the suitability of the therapy. Medical professionals generally design a personalized plan based on your needs and body type. Different dosages, administration frequency, and treatment duration characterize this treatment plan. Sermorelin is typically administered through subcutaneous injections. The injections are relatively painless and can be self-administered at home under medical guidance. Women undergoing Sermorelin peptide treatment will be regularly monitored to track progress and adjust the treatment plan if necessary. This ensures optimal results while minimizing potential side effects. You can get better results by eating a balanced diet, exercising regularly, properly managing stress, and having a healthy sleep cycle. It's essential to consult a qualified healthcare provider before beginning any new treatment, as they can offer personalized guidance based on your individual health needs and goals. Sermorelin dosages can vary depending on factors such as age, weight, current hormone levels, and the specific goals of the treatment. Dosages are usually prescribed in micrograms and are dispensed through subcutaneous injections. Here are some general dosages that the doctor might give. However, the exact dosages can be modified as per the patient's condition. The initial dosage for Sermorelin peptide treatment for women can range between 0.2 to 0.3 micrograms per kilogram of body weight, taken once daily before bedtime. Dosages may be modified over time based on how your body responds to the treatment. Your doctor will monitor your progress through regular checkups and may adjust the dosage if necessary. Once an optimal dosage is determined, it's often continued for a certain period. The maintenance phase could last for several months to achieve the desired benefits. Some medical professionals might recommend cycling the treatment, where you take Sermorelin for a certain period and then take a break. This approach is deemed to prevent desensitization of the pituitary gland. Following your doctor's instructions for dosage and administration is crucial. Sermorelin injections are often self-administered at home, but it's essential to use proper techniques and maintain consistency. As women strive to lead fulfilling lives, prioritizing their well-being becomes non-negotiable. Sermorelin peptide treatment offers a promising avenue for women to achieve enhanced energy levels, improved mood, and overall vitality. By stimulating the body's natural growth hormone production, this therapy can positively impact various aspects of a woman's life. From boosting skin health and cognitive function to promoting weight management and bone health, Sermorelin treatment can empower women in their journey toward holistic well-being. Remember, consulting a medical professional is the first step towards reaping the benefits of Sermorelin peptide treatment and embracing a rejuvenated, vibrant life. Sermorelin peptide treatment shows promising results in addressing key health concerns. However, it should be taken under the guidance of a qualified medical professional. A custom treatment plan made to meet an individual's health needs and goals is vital for optimal results and safety. Thus, it is always recommended to consult a doctor before beginning any new treatment regimen. It's confusing. Butter is bad. Moderate alcohol consumption of 2 drinks daily for men and 1 for women is healthy. Coffee increases your risk of a heart attack. Eggs elevate LDL, the bad cholesterol. Replace them with sugary cereal and donuts for breakfast. Low-fat diets are the best for losing weight. Saturated fats, especially those found in meat, must be minimized or avoided. Vitamin supplements are unnecessary. Every single one of those recommendations from the medical authorities and self-anointed food gurus, aka foodies, has been challenged and disputed. Some have even been proven wrong. Yet the barrage of medical research and studies continues unabated and also continues to wreak havoc on the health of the average person. It's enough to drive anyone out of their minds. Just when one approach has been adapted, we are abruptly ordered to do the opposite. It's maddening, to put it mildly. How is this possible? How could well-funded, educated scientists and medical professionals keep swinging and missing? One possible explanation is that the research methodology is fundamentally flawed. Let's take a look at why this is and discover a few guidelines to help navigate this health minefield. In a 2005 paper, Dr. John P. A. Ioannidis penned an article, "Why Most Published Research Findings Are False." He stated that the, quote, greater the financial and other interests and prejudices in a scientific field, the less likely the research findings are to be true. And the hotter a scientific field, with more scientific teams involved, the less likely the research findings are to be true, end quote. To develop a healthy degree of skepticism, here are a few things to remember when a new study comes out. Pharmaceuticals, supplements, and food are all billion-dollar industries. There is an ancient cliche. It is hard to make someone understand something when their continued financial well-being depends on their not understanding it. And that's often the case with health research. Someone is paying for those doctor-approved advertisements for the big drug companies, aka Big Pharma, the athletes who swear by a particular supplement, or a smiling, happy consumer of a food that produces effortless weight loss. When a natural, safe, and effective cure or treatment emerges that could threaten Big Pharma's bottom line, it will be met with more research is needed, and it's not regulated. At times, this may be true, but all too often, there is a lack of objectivity from well-financed research studies with a bias against holistic approaches. Exciting conclusions have been announced from animal studies. While promising and potentially game-changing for humans, people are not animals, and these breakthroughs should be interpreted with that caveat. If an X event occurs, it causes the development of Y, a human condition. Maybe, but maybe not. In today's complex environment, there are countless possible explanations for just about anything, and we need to keep that in mind by demanding hardcore correlations. A significant problem with observational-only studies is that when study participants are asked about their eating patterns, they often get them wrong. This is understandable. Most of us have trouble remembering what we had for lunch a few days ago. Even those rare souls who keep a written journal of their eating may forget or exaggerate their food. The gold standard of scientific research is the double-blind, placebo-controlled trial in which neither the researchers nor the subjects know who's getting the active treatment versus the placebo. But who chooses the placebo? Researchers sometimes choose a placebo that may distort a study's conclusions. Improper conclusions have been reached after using a different placebo than what was reported. Unbelievable, but true. A study of 6 subjects produced incredible results. Whoopee, let's come down to reality. Any new breakthrough will need more extensive trials with significant numbers of people to achieve statistical significance to elevate the result above the status of statistically inconsequential anecdotes. That seldom happens since gigantic trials are expensive and usually paid for by Big Pharma, which can pump the hundreds of millions of dollars required to prove their drugs work. Additionally, why sponsor costly research on non-patentable natural substances that other companies can easily copy? This is sickening and criminal since fraud in health studies is playing with people's lives, but it happens all too often. A recent example is The Lancet and the New England Journal of Medicine were fooled into publishing inaccurate research proving Where was the study done? In a modern nation with rigid scientific standards or overseas in a small developing country that might be rife with corruption? Who performed the research? Where was the study published? Was it observational only? Most importantly, who paid for the study? These are just some of the questions that need to be asked and answered when evaluating the quality of research. This is sometimes called the Lazarus effect and is often used to prove the uselessness of nutritional supplements. Lazarus was raised from the dead by Jesus. A supplement is given, too late to make any difference, to an extremely ill population suffering from terminal afflictions. Of course, the supplement has no benefit, so it is useless and only gives the recipient expensive urine. This dishonesty ignores the fact that the supplement may have been helpful if given to slow the progression of early disease or possibly prevent it from developing. If you found this video, well, you wouldn't call it HGH deficiency since the first H in HGH stands for human. But yes, pets like dogs and cats can suffer from growth hormone deficiency, or GHD, although it is relatively rare. GHD in pets is similar in some ways to human growth hormone deficiency and can have various causes. Here are some key points to consider. Growth hormone deficiency in pets can be congenital, present from birth, or acquired later in life. Congenital GHD is usually genetic, while acquired GHD can result from pituitary tumors, trauma, or other medical conditions that affect the pituitary gland's ability to produce growth hormone. The symptoms of GHD in pets may include stunted growth, in the case of congenital GHD in young animals, delayed or impaired development of secondary sexual characteristics, and changes in coat quality. In older animals, acquired GHD can lead to muscle loss, reduced energy levels, and other signs of aging. Diagnosing GHD in pets involves a thorough physical examination, medical history review, and blood tests to measure hormone levels. Imaging studies such as MRI or CT scans may be used to identify pituitary tumors or other structural issues. If GHD is diagnosed in a pet, treatment options may include hormone replacement therapy with synthetic growth hormone, similar to the way human growth hormone therapy is used in cases of GHD. The treatment plan and dosage will be determined by a veterinarian based on the specific needs of the pet. Pets receiving growth hormone replacement therapy will require regular monitoring by a veterinarian to assess the effectiveness of treatment and adjust the dosage if necessary. It's important to note that GHD is not a common condition in pets, and its diagnosis and treatment should be carried out by a qualified veterinarian. If you suspect that your pet may have a growth hormone deficiency or any other health issue, it's essential to seek veterinary care promptly to ensure proper evaluation and treatment. The reason I ask is that my dog seems to crave my HGH ampules and finds them very tempting. If your dog is showing any unusual interest in your HGH or human growth hormone ampules or any medication, it's crucial to take this behavior seriously and ensure the safety of your pet. Human medications can be harmful or even toxic to animals, and ingestion of HGH or other substances intended for human use can have serious consequences for your dog's health. Here's what you should do. Make sure that all medications, including HGH ampules, are stored in a safe and secure place that is out of your dog's reach. This will help prevent accidental ingestion. If your dog has ingested any medication, including HGH, or if you suspect that he has, contact your veterinarian or an emergency veterinary clinic immediately. Provide them with information about the substance ingested and your dog's symptoms. Keep a close eye on your dog for any signs of illness or unusual behavior. Symptoms of medication ingestion can vary widely, but may include vomiting, diarrhea, lethargy, tremors, seizures, or other signs of toxicity. Follow your veterinarian's advice regarding any necessary treatment, monitoring, or intervention. They may recommend inducing vomiting, administering activated charcoal, or providing other supportive care. It's essential to act quickly when you suspect your pet has ingested a potentially harmful substance, as timely intervention can significantly improve the outcome. Additionally, it's important to keep all medications and potentially toxic substances securely stored to prevent future incidents. If you have concerns about your dog's behavior, or if you suspect they have ingested any medication, please consult with a veterinarian for professional guidance and care. Every physician at our clinic is board certified. You probably know that already from reading our introductory material. But what does board certified mean? And does it matter? We believe it matters a great deal. Physicians must undergo extensive training, and you'd think that always means a lot. In most cases, it does, but some countries and regions have different medical degree requirements. In some cases, those requirements are more lax than those in the United States. Most people can't tell just by looking at a degree on the wall of a doctor's office just how rigorous that doctor's training really was. And sadly, a few individuals put themselves forward as medical doctors who really are nothing of the kind. Sometimes their fake degrees purport to be from overseas medical schools that are hard to check, and other times they blatantly put the names of the most prestigious medical schools in the US and Europe on them, knowing that very few people will ever bother to check up. And doing that checking isn't easy either. That's one area where board certification comes in. There are around 25 medical certification boards in the US. It's simple and easy to check on your doctor's certification status with them. That's one of the main reasons they exist. Just ask the clinic or your physician what board has certified him or her, and contact the board for verification. They'll be glad to help you and answer all your questions. The board has done all the checking, testing, and other demanding work for you. They check and certify each and every physician's medical degree. And since the board is composed of the top physicians in the field, they're very unlikely to be fooled by any fakers and pretenders. Fraudsters will never get certified. They won't even get to first base in the attempt. To be board certified, a physician must have been practicing in his field for a significant amount of time. They check up on that too. Must have been verified to have met all his medical degree requirements, and must undergo additional examinations, and very rigorous ones, considerably more rigorous than those given at medical school, that focus on his field of practice. When you come to our clinic, you can be assured that you are receiving the best professional medical care provided by physicians who have demonstrated their competence, ethics, and in-depth education in their specialties. Hawkers of the myriad HGH booster supplements and the like you'll find online cannot make that statement. Shady dealers in questionable and illegal imported HGH from Canadian or Mexican or Indian or other foreign pharmacies, which often aren't pharmacies at all, cannot make that statement. So many people are suffering from HGH deficiency today. It steals their years, their very lives away, with misery, illness, weakness, and old age coming too soon. We want you to change your life for the better. Come and get tested by our board-certified physicians today.